Welcome to another episode of the Federal Newswire Lunch Hour podcast with your host, Andrew Langer.
Well, hey there, everybody. Welcome to another episode of the Federal Newswire's Lunch Hour podcast. I'm your host, Andrew Langer, and if you are watching us on our YouTube channel, you know you can check us out on one of the many fine audio podcast platforms at which you can find the Lunch Hour. If you are listening to us on one of those podcast platforms, please check out what's happening in studio by looking at our YouTube channel. Leave a like, leave a comment, hit the subscribe button. You can also now follow us on X. I still call it Twitter because that's who I am, at Lunch Hour Pod on Twitter. Very excited to bring our guest on today. I've been wanting to talk to him for a bit now. We were on a panel together at the State Policy Network annual meeting. His name is Dr. Vance Ginn. He is the president and founder of Ginn Economic Consulting. But almost more importantly, I think you would agree with that, is he was the chief economist at the Office of Management and Budget. We've had former OIRA administrators. We've had at least one former OMB director on the show. This is very much in my wheelhouse. And let me start here, Vance. Let me start in this way. I've talked about this a little bit, that to me, economics is the study of mass psychology in action. Right? It gives us a snapshot of what people are truly thinking and what they're believing based upon their economic behavior, right? And it's one of those objective metrics. What are your thoughts? Am I right or wrong in this?
No, I think you're heading down the right direction. I remember I taught economics for a number of years at universities, and then I've been in public policy now for about a little over a decade, along with working in the White House. And the way that I always like to define economics is the study of the study of human action and interaction using scarce resources within institutions, given all the scarcity that we have going on around us. And in economics, like the textbooks would just say the study of using scarce resources efficiently and effectively. Well, it's like, who is doing this and why are they doing this? And it's really about purposeful behavior, to your point, about people acting and the mass psychology of things and really getting into the trade-offs that go on. To me, there's no other subject that really looks at the trade-offs. So if you make one decision, you got to give up something else. And that's one of the big insights I think we gain from economics is really about those trade-offs.
I had a conversation with Steve Moore about 8 months ago, because I do regulatory policy and I do healthcare policy. And one of the things that I like to talk about is the fact that we do not talk about healthcare in America as a resource economics issue. There is not just a finite amount of healthcare, which I define, frankly, as, well, we could talk about goods, right? Pharmaceuticals, devices, we may want to talk about that. But I also talk about it in terms of the time. The widget is the amount of time that a patient spends in front of a medical care provider. And we have a declining number of medical care providers in America. And yet, for whatever reason, we keep thinking that if we start handing out chits that supposedly give people access, then we're somehow going to solve the healthcare problem. Your thoughts on all of this?
Well, look, I mean, healthcare is a major issue for all of us. We're all going to need some form of healthcare 100%. Over time. And hopefully we would see increasing outcomes and improving patient care with all this money that we're spending, and we're just not. And so I agree with you that it is a scarce resource. And I also believe that there's no right to healthcare, because if there's a right to healthcare, then that means that the people who are providing it have to be forced to provide the healthcare for you. Right. And meaning that doctors and nurses and others can't get paid. And so this creates a lot of other ways to ration the system by long wait lines, by maybe not getting the care that you'd like to get at that time. And that's what we've seen, like in Medicaid, for example. Medicaid, you have coverage, but coverage doesn't equal care. It's hard to find quality care if you're on Medicaid, because in Texas, where I live, about 40% of doctors do not take new Medicaid patients. And across the country, that's the case because of the low reimbursement rates. And also, so you can't see a doctor. It takes a while. So you also got to wait in line. So oftentimes, what do? You go to the hospital when they don't necessarily know anything about you other than you're coming in, you have a form of payment, but you have no other information for them to go off of. And so you don't receive the care that you should need. And so, look, we've got to move away from this socialist system that I believe we have here today. Some of the work that I've been doing on this, Andrew, is, 60% of every dollar, 60 cents out of every dollar that's being spent across the country, which is about $5 trillion in the United States, is how much we spend on healthcare, is paid for by government, meaning you and I, the taxpayers, are paying for that because the government has no money. Nothing is free. And so what I've been working on, I have another a book and some initiative that I've done with the Americans for Tax Reform called Empower Patients Initiative, to where we get back to a market-based system of healthcare, or not even back to, get to a market-based system that brings the patient and the doctor back together for that voluntary exchange, instead of it being based on reimbursement rates determined by private health insurance and by mostly the government.
So I appreciate what you're saying, because I've been saying for a while that we need to engage in this kind of moonshot approach to creating more care. It's the only thing we can do in the face of increasing demand. And whether it's fixing the guild model of medical schools or dealing with the issue of residencies, because even if we produce more doctors, we don't have enough residency programs to go around, and finding ways to fund those residency programs. It's all, but it all gets down to this. The only way we can reduce price, and I know price and cost are two different things, Vance, but the only way we can reduce either in the face of increasing demand is by increasing supply. And what we're doing now is exacerbating every reason for doctors and nurses and physicians' assistants to get out of this. It's just not sustainable. And you're absolutely right. At the end of the day, we can't compel people to engage in these things, can we?
No, not at all. And not if we want to get good outcomes, and not if you want to have better care, which I think we all do. Government socialism doesn't reach those outcomes. There's always going to be distortions that happen in the marketplace when you have so much government involved. And, with Dr. Dean Waldman, who's my co-author in this book he wrote, Empower Patients, we talk a lot about that. And he's a medical doctor. I'm an economist doctor. And so we came together.
My
to
wife
talk
is
about,
a physician, so I get this entirely. So go ahead, please.
Yeah, exactly. And so, he came at it from the physician angle, saying, look, I have to do all this paperwork. I've got to hire more people, instead of what I want to do is just help take care of people. And one of the things that we came up with, Andrew, in looking at a lot of the research out there, is that about 50%, up to 50% of the 4.9, let's say $5 trillion we spend on healthcare is actually not going to care. It goes to bureaucracy, unnecessary sort of procedures, a lot of other things that basically deals with paperwork and bureaucratic bloat. So that's close to $2 trillion that's not going to care. Now, some of it may be needed for some capacity, but I think healthcare should be about getting better care for the patients instead. And our big three things that we think would help to revolutionize healthcare to a more market-based system is, for one, get rid of the employer-sponsored health insurance tax credit. That goes to the employer and forces them to buy private health insurance and reduces portability, and instead give it to the workers. Give it to the people to have it of their own capacity to spend it how they want. The other part of this is a no limit health savings account. Why do we put limits on health savings accounts? If people need more, let them put more in there to go for their care. And then that also gives incentives for them to use it or not, given how much money is in the program. And the other big one here is on block grants to states for Medicaid.
Sure.
And we should get out of this business of the federal matching assistance program, because what that incentivizes is for states to spend more and then bring more federal money down, meaning our taxpayer dollars, and redistributes that money around. And instead, we can use our system of federalism, this laboratory of competition, to see what works and doesn't work by giving states flexibility with those block grants. And I think we could really revolutionize our healthcare system by just doing those three things to get us back on track to bring in more supply. Now, I also agree with you, though, because that's more on the demand side, right? It will influence the supply side. But I also think we should be looking at scope of practice for nurse practitioners. We should be looking at ways that break down a lot of the licensing barriers that 100%. Go in, because that's also really reining in a lot of the supply side.
Right. The idea, if you're a radiologist in Wisconsin and you have some spare time, you should be able to read charts that are being or read images that are being taken in Idaho, rural Idaho.
Yeah.
Let's turn our attention a little bit, because you've done a lot of writing about this. I direct the Coalition Against Socialized Medicine. And there's a lot of discussion right now. You got Zoran Mamdani running for mayor in New York. There seems to be a fundamental misunderstanding about communism and socialism and the problems therein, And you've taught at the university level, and we know the role that universities can play in all this, but why do you think there seems to be this fundamental misunderstanding of the very basic economic principle that the problem with socialism is that pretty soon you run out of other people's money?
Yeah, Andrew, I mean, there was recently a poll done by Gallup, right? They do some great polling out there, and they showed that the share of Americans, at least in their poll, that believe now in capitalism was down to 52%.
Wow.
Which was the lowest that they have on their record whenever they started keeping this. And so it's only half of Americans. And so what that's meaning is that they're more engaged with socialism. And now you have a lot of these politicians, whether it's AOC or Bernie Sanders or now Madami and others that are out there that are really trying to speak this idea that socialism is the best path forward. But I think when you look at this, you first see that capitalism is what's helped bring billions of people out of extreme poverty of less than $1 a day and so forth. I mean, even in places like China, after they had the 1978, when they started to open up again to the rest of the world, that's when you started to see the poverty drop substantially in China, as they had a little bit glimpse of capitalism. But now it's been heading in the other direction with President Xi there over the last decade plus, unfortunately. And so what we need is to be able to highlight, and what I would do with college students and still do today, is where do we find socialism in the world, at least as close as it can be, is Venezuela, for example. Venezuela is running hyperinflation. They have food rationing of how much food you can get on which certain days. These are not what we expect in America. So it sounds good, like, okay, the government can come in and solve these problems. But again, it goes back to trade-offs. Where do they get that money? Who decides what's going to do? In the marketplace, human action is purposeful, meaning that we like to voluntarily transact in order to get whatever it is that we want at a specific price, and we can negotiate that price. Well, in socialism, it's a top-down approach because the government's going to tell you what that price is, and you have no other choices about it. So it's not voluntary, and it continues to have more control by government versus control, but I would believe is the individual. And so I think by explaining it in more clear terms, because I think it's kind of this, it's just something that people can't really even, understand of what the economic system is. And no one person can. And that's the point, is that you want millions of people in the marketplace to decide this. Going back to Hayek's The Knowledge Problem, I think there's so much into that really we do not have the knowledge of what everyone else should do, whether it's in healthcare. You and I, we know a lot about the policy, but we don't know the individual exchanges between the doctor and the patient of what those cares are going to be. That should be up to them. And the more that we can get into people having more power and control over their life and less from government, the better off we're going to be, I really think, in any market that you look at.
We've never had a greater portion of the people essentially engaged in and there's the working age people engaged in the sort of the ideas of self-ownership, right? The gig economy is predicated on the idea that people know best how to spend their time. And yet at the same time, they can work for X, they can work for Y, they can do a podcast, or they can do some consulting, or they can do, whatever. I know that's speaking from my own experience. But you can start your own little business here, and you can do this there. And yet we've never had more people doing that. And yet haven't had, as you said, ever more people saying that government ought to be deciding. And this disconnect between, if the government decides what goods or products and how they are priced in the marketplace, then they decide what job you have and when you go to your job and how you go to your job. That's a real, I mean, these are the things, I guess, Vance, that as we talk about this, sort of the fundamental disconnects between left and right, and the very different perspectives. I'm fortunate in that once a month I sit down with folks in the healthcare world, across the political spectrum, and so much of it is just about them better understanding my perspective, and in turn my better understanding their perspective. But the divide is massive. Listen, I always say you can't reconcile liberty with anti-liberty. And yet there's so much that they want to do to talk about this in terms of bridging that gap and making that case for capitalism.
Yeah, no, it's a great point, and I agree with you that there is this disconnect that's going on, and unfortunately, I even see it on the right. I mean, we have some on the right who want
exactly
to push,
where I was going.
Okay, push more government and everything else, but I think getting back to the basics of that before we get into there is the principles of liberty are a major part of America. I think it's the biggest part that makes us great. I mean, you have the Constitution, you have all these other things, but what was that for? It was to preserve liberty.
Right.
And so the more that you veer away from that, the more that you have control by someone else, especially government and politicians, which of course, look, they're rent seekers. They have to win re-election. So they don't have the same marginal cost and marginal benefits. This goes into public choice economics by James Buchanan, which talked a lot about this. They need to get reelected. So they want to do something. What I think it is for me, who works a lot in the public policy space, is to try to give them something that's going to continue to preserve liberty. And right now, that means rolling back government. I think we're already too much government, because what I see some, and we can get into this more on the right, is that they say, okay, here's a problem. The problem needs to be solved by government. If we just have the right people in charge, we can get that to be done, without really understanding that the problem really is the government to begin with was already infiltrating healthcare and education and other things. We don't need more government, because the problem was government failure, not market failure. And anytime you try to solve a government failure problem with more government, what do you get? You get more failure. And so that's what I'm really concerned about there.
It's what I used to talk about with the lessons of the 60s, right? If you had a corrupt, intrusive government, whether it's Nixon or Johnson or whomever, J. Edgar Hoover, whomever, right? The idea was there was, and I'm going to say a revolution, a soft revolution, the late 1960s, brought about the Church Committee, right, to reform the intelligence agencies and the abuses of power there. The idea would have been, right, if the idea is that if government is the bad actor, and abuse their power, then people are punished, and you take that power away from them, so they can't do it again. But the left instead felt that they wanted to institute this benign, loving government of their own, and of course, at the end of the day, that government is going to abuse its power. Right? You continue to concentrate power. Yeah, we had some opportunities in the first Trump administration. I talk about, to me, like the objective expression of this is regulatory costs and regulatory mandates. And if you shrink the number of regulatory mandates and you shrink regulatory costs, then you're shrinking the scope of that power and how that power can be abused. And we had, the first Trump administration was the first administration to actually, adjusted for inflation, reduced regulatory costs over time. And which is unprecedented in the modern regulatory era. But now we see this very strange impulse, as they're doing some really great deregulatory things. I don't want to poo-poo that. I mean, I'm literally writing 2 sets of regulatory comments today to agencies about deregulatory issues. Yeah. But there is this impulse, the nanny state impulse. Talk about your concerns here.
Yeah. And you're right. So in the first Trump administration, I was there as chief economist for the Office of Management and Budget from June 2019 to May of 2020. So kind of the last part of it. And I worked a lot with Paul Ray, who was the OIO administrator during that time. He did a lot of great work. And my team was looking at the marginal cost and marginal benefits and providing cost benefit analysis of section, was it 103775 or 773, where it was the 2 in, 1 out. We ended up doing about 5, I think it was 5 out for every 1 in.
Sure.
And now they're trying to do 10 out for every 1 in. But what it does, to your point, I mean, look, regulations are costly. They're a hidden tax,
100%,
hidden costs on all of us that we don't see, but they're out there. And the numbers that have been out there that do try to estimate these, like Mercatus has done this and some others, is, it's trillions of dollars. Right. That we don't see, we don't necessarily pay directly, but we are paying for it through the form of higher prices, lower wages, fewer jobs.
Let's stick a pin in that for a second. Yeah. Wayne Cruz, my good buddy Wayne Cruz, says it's $2.5 trillion. Yes. Me and the folks at AFPI and some others, we say it's closer to $4 trillion, depending on who you talk to. And then you get into what oh good Lord, Patrick McLaughlin at Hoover talks about the opportunity cost issue, and his is $2 of lost opportunity cost for every dollar. My numbers are somewhat higher, and they may be a little bit out there, but the point is, it gets to exactly what you're talking about here. It's, you make a choice. You're forced to do capital investiture here, right? You have to spend $15,000 to put in a new whatever the oven is, the government, an electric oven,
right?
That the government wants you to use for your pizza shop. And that's money you can't spend to hire somebody else or other efficiencies. And then you're spending money on electricity and your pizza quality, all of these things. we're really bad at this.
Yeah.
Let's talk about that. Then I want to come back to cost
Yeah.
benefit analysis, because I had a conversation with Wayne Cruz the other day about this, and Wayne said some things that were concerning, and I'll be oblique about it, but go ahead.
Yeah. Well, Wayne is great. So
Yeah,
I look
Wayne's
forward to
fantastic.
that part. Yeah, of course. I'm working on a book right now on regulations. And so and really trying to explain it for the average person to understand, because right now I'm sitting in my office recording this with you, and I'm looking around at all the lights. To your point, there's regulations behind those lights that's costing me more than I otherwise would. The structure of my house is regulated. The zoning, right? All these
100%.
things that you don't understand are all driving up costs on all of us. And it comes back to, like, what is it really doing? Is it really helping the safety or is it a regulatory capture? Is it trying to block some people out of the market and let some in? And it comes back to this point we were talking about earlier about who decides.
Yeah.
It's government. It's the regulators who are deciding. It's not the people. Look, to me, the best regulator are prices.
Of course.
If people don't want something, they don't buy it. So the price goes down and they go out of the market because they can't profit. When you have more profit, that's telling you that people want more of it. And so, the Cozian theorem is that you should be able to price in these overall regulations and any sort of quote unquote market failures. I say that because, Andrew, I really don't believe the market fails by itself. There are things that we look from a third party perspective and say that's wrong or that's not the outcome that I would have wanted. But it's always us making that determination, not the people in the transaction.
Yeah.
And I think that's where the regulations have had such a huge cost. And one last point I'll make on this, we can expand on this if you want, but I just had another paper at Americans for Tax Reform talking about, will we hand over our biotech to China?
Right.
Because what we're doing in America is trying to reduce pharmaceutical prices, drug prices in America through most favored nation and other things to bring those prices down. But the research on this shows that if you bring prices down 30 to 40%, you're likely to see a 10 to 20% drop in research and development.
Yeah.
Meaning we're not going to get the same cures for cancer and Alzheimer's that we otherwise would. So there's this trade-off.
And let's add to that today's name brand small molecule drugs that are developed, and today's biologics that get developed, if we don't innovate those, we don't get the biosimilars in 12 years or the small molecule generics in 12 years. I mean, it's interesting. Let me ask you this. This is out of left field. And you never ask a question you don't know the answer to, but I would love to get your take on this debate, because I'm working on a paper. Just submitted a proposal on ways to streamline compliance with regulations, and the idea of using an AI tool. And I've been talking about this for 23 years, since the inception of regulations.gov, some kind of a companion. And I was talking about this with a colleague who will remain nameless, and he said, Andrew, I appreciate what you're trying to do here. My concern is, if we massively reduce the cost of paperwork compliance, right, we make it easier to comply, then it creates perverse disincentives against, regulatory reform, because people are no longer feeling the pain of paperwork. So they may I want to get your thoughts. I mean, to me, if the goal is to reduce cost and make it easier to comply, isn't that the benefit therein? But what do you think about this issue of disincentivizing regulatory reform?
I'm not buying it. I can kind of see where they're coming from, but I don't buy it because look, at the end of the day, to your point, we want an outcome. Why would we want to put more paperwork to getting to that outcome? That's just a waste in economic terms.
Almost a regulatory capture issue. The idea of if you're getting paid to engage in regulatory reform and all of a sudden the incentive is gone, how can you raise money on regulatory? See, to me, we'll always be dealing with this back and forth, even if we reduce paperwork costs, there are always going to be capital mandates that are problematic.
Right.
Good. As long as you and I are on the same page here, because that makes me feel good. But let's talk about this nanny state stuff. No, actually, let's talk about costs and benefits. So this is the conversation I had. I don't think he'd mind if I said this, because he alluded to this in a recent piece that he wrote. Wayne is concerned, and I get this, that we spent so much time fighting over how we assess costs and benefits. The Biden administration created a whole new way of measuring costs and benefits, where they essentially announced, they said the quiet part out loud, we don't care about costs, and we're going to massively overstate and artificially inflate the benefits of regulation. One of the first things Donald Trump did was he went in and he changed the whole circular A4 thing. But Wayne is concerned that we are missing it, that it's no longer just about costs and benefits, but now it's this implementation of regulatory dark matter through guidance and things that don't talk about this. Whether or not there are other threats out there, I don't know, some other analog to regulatory dark matter on the cost and benefits side. What are your thoughts here?
Yeah, I think it's definitely a good point to bring up, because it is difficult sometimes to decide, okay, well, what's the value of these benefits?
Right.
And they do a value of a human life, and
Sure.
that's always skeptical to me of going down that direction. I mean, COVID, we were doing some of that then. Whether or not we should act, and all that stuff. And because I was there in the Situation Room with like Larry Kudlow and others talking about like, what's the effect of this going to be on the economy, and what happens if we shut down. And I was always against the shutdowns.
Let me tell you something. Hold on for a second. Literally, when I was doing this regulatory lobbying for NFIB, I got called into HHS. And this was when we were talking about H1N1 bird flu. So this is, 15, probably 20 years ago. And they said, well, what happens if we shut down the economy for 2 weeks? And I said, well, you're going to throw all of my members out of business. So we've been well on the record with the impacts then. But then you get into the comparative risks, the other sociological effects. I'm sorry, I rudely interrupted.
No,
go ahead.
No. That's great. I mean, because in this case with COVID, right, you had some folks saying there would be 2 million deaths.
Yeah.
If we did nothing. And anyway, there was a lot of stuff that was going on there. And I think going back to what Wayne was saying is one of the things I have been concerned about is the number, right? Like if you have 5 out, 1 in, well, what is really the net cost or benefit? Now they should be calculating that and seeing whether or not it's a net cost or benefit, but how do they put that in their models? How do we know for sure that those 100%. Are the right numbers to look at? And it's oftentimes very difficult, to your point about Patrick McLaughlin and others who look at the opportunity cost, which we should, but it's difficult to put a value 100%. To that. And I don't know if you've ever read the book, Where's My Flying Car?
Oh, yes.
Yes.
We've had Tim Jackson, my old NFIB colleague. I've had Tim on the show.
Okay, good. Well, that's an awesome book. I love it because it really explains how we could probably have flying cars today had it not been all the regulations and crap that have been put on it. And so I think at some point, to go back to Wayne's point though, is when do we start saying, okay, our baseline is fixed and we're just going to keep looking at cost of benefits up from there, when really we should be shrinking the regulatory state. If it's 2 trillion, 4 trillion, 100%. Like you mentioned earlier, it's massive. We should be looking at ways to bringing it down, not just the net cost of it going up or down from the current baseline where it's at.
All right, I got a another weird question. Do we as free market limited government regulatory guys, do we need to take over the administrative conference of the United States? I mean, it's one of those things where they're looking for leadership. I don't think it's on. So to me, this is me sort of now geeking out. To me, the 3 greatest jobs in the federal government are the administrator of OIRA, so the regulatory czar, the chief counsel for advocacy at the SBA, and the national ombudsman for small business. But understanding the role that the administrative conference of the U.S. plays in sort of the academic setting of regulatory policy, I think we need to spend some time there. I don't know. Maybe you disagree. Yeah. Maybe I'm looking way too inside baseball on this. But
to be honest, I don't know a whole lot about that. To be honest with you,
got it.
But it may be worth it. I think. Look, I mean, I think the Trump administration is heading in a good direction
because we have the influence of the National Academies of Sciences, which shockingly, I'm shocked. I know you are. They came out, with a paper trashing the Trump administration throwing out the greenhouse gas endangerment finding. And so we know the National Academies has been corrupted, but it's like maybe I don't know as we're setting this policy because. It was to some extent ACUS that allowed the circular. I don't know. Anyway, maybe this is way too inside baseball. We should take it offline.
If I could add something on that I think the overturn of Chevron deference 100%. Is a key step in the right direction. But I don't know where you're at on this, Andrew, but I'm still kind of concerned that Congress doesn't know how to write 100%. Specific, more things that can actually be done in law. They're used to writing it vague, which is still going to give the regulators more power.
This is exactly what Veronique Derougy and I talked about before the Chevron decision came out, was this issue of, are we prepared for this? And, some of it is in the fact that we're throwing out, very big regulations. And to me, right, as activists or folks in the think tanky world, we should be challenging regulations, opening up new rulemakings for petitions. Part of what I appreciate about what the administration is doing is through this RFI process. Every agency is asking for recommendations in this regard. That's an important step, because if Congress is not going to act, then there are tremendous opportunities that are out there. It also cuts both ways, right? It means that especially, and let's go here now, especially in areas where we get concerned about the nanny state on the part of our friends, right? And they are friends, they are brothers and sisters, but the nanny state impulse there, thankfully, Chevron, at least in theory, ought to rein them in as well. Let's talk about this in terms of things like nutrition policy, things that I'm concerned about and where this goes. I right after you did your presentation on the biologic issue, I was talking about the Maha report and the issue of if we do X, Y, and Z now, we run a real danger of a President Newsom, President Harris, President Walz, President Buttigieg coming in and saying red meat is bad, therefore we're going to say that people can only buy insect-based protein, or even plant-based protein. Let's not even be so disgusting, but plant-based protein as if they're on food stamps. And I think we would have a problem with that. So talk about this, about consistency and the nanny state and the problems there, and also just the bad policy aspects of it.
Yeah, no, I think these are all key points, Andrew. I mean, when you look at it, it sounds good. These policies sound good. We shouldn't buy junk food. And if you're on food stamps, you should be able to buy healthy food and not Twinkies and sodas or whatever. And those sound good as talking points. But when the rubber meets the road, what's the reality?
Right.
That's on the ground. And what this is doing is putting more hands and more power in the hands of politicians and regulators than the people. And what I want to see is more agency. I want to see more people out of poverty and more people in 100%. Prosperity. And we can't do that by controlling their decisions.
Yes.
And this isn't government money, it's taxpayer money. So I get that too. Like, taxpayers are like, well, I don't want them to buying Twinkies and other things. But remember that, for one, who decides? You can't go in and make these decisions, because the more decisions you make them dependent on it, which is the nanny state, the less agency that they're going to have when they get off these programs.
100%.
And they're going to get back onto it. The other part is that if you have them buy more healthier foods, or if we're looking at other things, a healthier alternative, those healthy alternatives tend to be more expensive.
100%.
When they're more expensive, they buy less, so they're getting less nutrition than they otherwise would, or it costs us more as taxpayers because we're going to fund that additional amount of money that they need to be paying on these healthy foods. And so I think my bigger problem is the nanny state and the dependency that it continues to create and metastasize throughout our system. Even if I am concerned about the obesity problem in America and the health problem in America, I just don't think that the government does a good job of that stuff. It should be up to the private sector. If anything, I think the government may have a role in providing information, saying, here's the information that you want to learn about and how to eat healthier. But we have to be careful, because even when they did this years ago with the food pyramid, we're now learning, right? Or have known for a while now, that that's not the best.
It's the nanny state that gave us hyper-efficient HVAC systems that contribute to childhood asthma. It's the nanny state that gave rise to the helicopter parenting that keeps kids from being outside, playing outside and staying home and on video games. I mean, all of these things are ancillary impacts.
Or social media, Andrew. Like, everybody wants to shut down social media now. Well, some of those things push us in that direction.
Right. So let's talk about this before I let you go. How did you get interested in all this?
It's been a wild story so far, Andrew. I mean, I started off from a low-income family. My mom and dad got divorced when I was young. My dad had epilepsy, so he lived with his mom, so he was on disability. So we were low income from South Houston. I went to homeschool in the latter part of my K through 12, and I got in a rock band, played the drums. Yeah. I was a drummer. I am a drummer. And we were one of the top 5 rock bands in Houston in my late teen, early 20 years.
You and Seton Motley. Anyway, I'm sorry.
Man.
Texas rock and roll. Go ahead. Yeah.
And I got in a really bad car accident where we rolled 6 times, May 25th, 2002. It always comes back to me. But it was really the turning point in my life where I felt God gave me this calling to let people prosper. And so I went from being a low-income, homeschooler to rock star to going to college, being a first-generation college student, and getting a PhD in economics, and working at the Texas Public Policy Foundation, one of the largest state-based think tanks. I worked there for a decade.
Yes.
Well, I worked in the White House. That was phenomenal. And I'm always looking at ways to give more agency to people and allow them to prosper. And I think that's done through liberty and free markets and the stuff that we as on usually on the right, more classical liberal thinking that's the direction it's been. And so now I find myself speaking out even among some of the those that are on the right who claim 100%. To be on the right, because they want more of this nanny state. And it's something that I think we've got to do a better job. And I'm continuing to do this to try to fight back. And I've got a podcast now called Let People Prosper. Yes. That's the name of the show. And
love it.
VanceGinn.com. Anyway, I've got a lot of stuff that I'm working on this because I'm passionate about getting people to live their dream. There's not the American dream.
Do you still play the drums?
I do. Yeah.
So who are you? Because listen, you said that, and obviously I can't play instruments worth a damn, but I love music. And in fact, we did. I live in Williamsburg, Virginia. We played trivia on Friday night. One of our team members was a William and Mary law professor. Okay. One of the categories was the Constitution. We dominated that, but we dominated the finish the lyric classic rock songs. So because that's very much in my wheelhouse and my wife's wheelhouse. Nice. So who are your influences when you what got you interested in playing drums?
Yeah, well, so remember, this is the late 90s, early 2000s. So we were Korn and Deftones and Tool. Danny Carey from Tool is probably my favorite drummer in the world. Wow. Yeah. So we were hard, we were hard rock. We had mosh pits going on and all kind of stuff.
That's amazing. Well, it's one of those things, right? We could put together one hell of a rock and blues band amongst the conservatives. Larry Spywak at the Phoenix Center plays harp, blues harmonica. Jim Neal plays guitar. You play the drums.
Yeah.
Seton I know plays drums. Of course, he's not in the country anymore. So for me, it's so funny because one of the great joys that I had when I was doing terrestrial radio for a major corporation was I was starting to interview a lot more musicians. And one of my favorites was Steve Gadd. I don't know if you're familiar with Steve Gadd, but he played drums on 50 Ways to Leave Your Lover. He played drums on Van McCoy's The Hustle. That video is up on YouTube. It was fantastic. So for me, it's Steve Gadd, it's Hal Blaine from the Wrecking Crew. I mean, it's Ginger Baker, Keith Moon. So nice. I saw. It's so funny. Saw the Who a couple of weeks ago at Madison Square Garden, and
wow. Yeah.
It was incredible. Anyway, I'm sorry, Vance. Awesome. How do folks find out more about your stuff? Where do they go to find your podcast? Where do they go to find your blog?
Yeah. Thanks for the opportunity, Andrew. It's been a great discussion today. So the best place to go is VanceGinn.com. That's where I have all the information, or you can sign up to my newsletter at VanceGinn.substack.com, but just go there. And my Let People Prosper show, there's a link there, and it's all on all the major platforms. And so that's the best place to find me, VanceGinn.com.
Awesome. Vance, listen, thank you so very much for joining us today.
Thank you so much.
So this has been yet another episode of the Federal Newswire's Lunch Hour podcast. Our guest has been Vance Ginn. Go and check out his work. He and I are going to have more conversations. He may not even know it, but we're going to have more conversations. If you are listening to us on one of the many fine podcast platforms that are out there, check us out on our YouTube channel. Please leave a like, leave a subscribe, leave a comment. Let your friends and family members know all about it. Follow us on Twitter at Lunch Hour Pod. I'm your host, Andrew Langer. Enjoy the rest of your lunch.
This has been the Federal Newswire Lunch Hour podcast, hosted by Andrew Langer. Check out the Federal Newswire's family of websites, as well as their social media stream.